Hello, this is Congressman Lynn Westmoreland, and I represent Georgia's 3rd Congressional District. I'm coming to you today, this afternoon, to report that, as many of you have already heard on the news, that the House Democrats today introduced H.R. 3962. It's the new revised version of House Bill 3200 that they had originally introduced. When they originally introduced it, it was 1,091 pages. As it was introduced today, the new improved version was 1,990 pages. If you want to get a copy of that, you can go to thomas.gov and print you off a copy of the 1,990 pages, or you can just read it while you're online. You know, at the press conference today, Leader Hoyer talked about the urgency of this bill. And if it's so urgent, why does it not go into effect until 2013? There's 36, says it's going to insure 36 million Americans that don't have health insurance. We don't know that, and neither do they. But this bill, the urgency of it is to raise your taxes and to collect your money, because what you may not realize is that this is an urgent tax bill to get in revenue. They're going to tax small business that don't have insurance for their employees. They're going to have a premium tax on people that make over $500,000 a year. That was raised from $250,000. But you know what? 25% of those people are small business owners. So they're going to get a double lick on the small business guy. They're going to have an excise tax for the first time ever on medical devices. So if you have a wheelchair, or if you have oxygen tanks, if you wear contact lenses, you're going to pay an additional tax. Your health savings account that many of you have at your employment right now, or that you may just have personally, right now you can use that health savings account to buy over-the-counter drugs. You will no longer be able to buy over-the-counter drugs with this health savings account. And you know why? Because they want to drive you to use prescription drugs, because of the deal that they made with pharma to save the $80 billion. This is part of that deal. No more reimbursement for using your over-the-counter drugs. It will have to be a prescription. So if you look at what they're doing and when they're raising the taxes today, and the fact that if you hear an estimated cost of about $900 billion, it's trick accounting. Let me tell you the reality of this thing. They have priced this thing as revenue for 10 years because they're going to collect the taxes next year. The expenses are only 7 years. Wouldn't you love to do your books like that? You know, have revenue for 10 and your expenses for just 7. That's the way that they're making this come in under $1 trillion. The other thing is, you know, that the doc fix, you're going to hear that term a lot, a doc fix. The doc fix was to fix the Medicare reimbursement that the doctors were expected to have a cut of 21%. But you know what? The doc fix, now they're taking it out of this bill and putting it into a separate bill where it will not be under the scrutiny of PAYGO. Look, the Democratic leadership up here and the Democratic majority is full of smoke and mirrors. They're pulling rabbits out of hats. They're pulling things out of places we never even knew they've had. They've used every kind of trickery in the world. They talked about that this bill was written in transparency, and I've got to admit, the bill that went through Education and Workforce was written in transparency. The bill that was written in Ways and Means was written through transparency. The bill that went through Energy and Commerce was written right in with transparent things. We could all look at, we could all see the amendments, but when they got together to forge these 3 bills into one, they were nowhere to be found. They were in some kind of smoke-filled, closed back room making a deal to try to come up with 218 votes. That's the reason this bill went from 1,090 pages to 1,990 pages, is what they had to do to get something passed. We believe that they just disregarded everything that happened in August. They have just forgotten about that. It's almost like August didn't even exist. We'll see when this thing comes to the floor. They're going to have an amendment to it, I'm sure, that will probably be brought out Monday or Tuesday. And then hopefully Leader Hoyer has promised us that we'd have 72 hours to look at the finished product. So we'll probably be voting on this next Saturday. Let me explain something else to you. We hear a lot of people say, you know what, we can stop this, with the 2010 elections. Listen, even if Republicans took over the House in 2010, we could not stop this bill. This bill cannot be stopped until after the next presidential election of 2012. Because anything that the Republicans did, even if we pass something to take away some of these things, the president most definitely would not sign it. So don't think the 2010 election is going to be a backstop. This is going to take place in 2010. If this bill passes, they're going to start collecting their taxes. They're going to start doing their Medicare cuts, and they're going to start doing the other things to raise the money to pay for this. You know, I was looking the other day at how much Medicare was projected to cost when it first went into effect in 1965. It cost about 10 times what it was projected to cost. The same thing with Medicaid. The only thing that really came in below the projection was when President Bush and the Republicans did the Medicare, the Part D prescription drug. It was estimated to cost $49 billion. It came in at $41 billion. The reason it did that, it had competition between private companies. The government was not in it. The government said, okay, you private companies bid on the Medicare Part D. And they did, and it came in less. You hear that we're going to have this public option or competition option or whatever they're calling it now. But it is private sector competing with the government. The private sector can't compete with the government. We've seen that with the Postal Service and other things. It just doesn't compete. So don't be fooled by that. Now let me talk a little bit about what you need to do. We have 178 members, 177 right now in the Republican conference. It takes 218 votes in Congress to either pass or stop anything. We don't have those numbers. And we're going to fight as hard as we can. And Leader Boehner said today, we had a conference meeting, and he said, you know what? This is what I came to Washington for. This is why I came to Washington, to take on some of these tough battles and to stay in the fight and not to give up. And we're not going to give up. We're going to keep fighting, but we need your help. And I want to encourage you in the next week, whether you can get with a friend or a group or whatever to get in your car, a bus, on a train, on a plane or whatever, come up here and walk the halls of Congress and let people know how you feel about this. Get on the phone. Call some of your family, your friends that you know in other states. If you live in the 3rd Congressional District of Georgia, I can tell you right now, I'm going to fight this with every ounce of strength that's in me, and I'm going to do everything I can to expose all the details of this bill. I'm not going to tell you that I've read it yet because I haven't. But we're going to read 1,990 pages of it, and we're going to try to get that information out just as soon as we can to the public. But just from the things that I've told you, I think you're probably opposed to it. If you are, get on the phone, get on the internet, call the U.S. Capitol, call the Speaker's office, call family, friends, anybody you know, and just say, look, we have got to mount up. This is a call to action. This is our alarm clock going off in this country. Since President Obama has been sworn in, this country has taken a hard left-hand turn. It's time for us to right the ship. The only way we're going to be there is to say, look, it's up to us. We've got to do it. only one person, but one person times 10, times 10, times 10, times 10 is thousands and hundreds of thousands. So I hope you'll join us in the fight. You know, our office number in Noonan is 770-683-2033. The number in DC is 202-225-5901. We'd love to hear from you and let you know how you feel, but I just wanted to let you know how I feel, how the Republican conference feels, and what you and I have got to do together to save this country. Thank you. God bless each and every one of you. Good night.